Disclaimer: We Level Up is not promoting the use of Xanax and alcohol. This video explores dangers and consequences, not endorsement. Learn, don't use. Comment below. Stay safe. Welcome to the We Level Up Treatment Center video series. In today's video we will discuss Xanax and alcohol. What is Xanax? Xanax, a brand name for alprazolam, is a potent and the most commonly prescribed benzodiazepine, benzos, that is only recommended for use for up to 6 weeks. It is a prescription drug used for anxiety treatment. Xanax is also prescribed for panic attack treatment. Taking Xanax use can lead to physical dependence and addiction. In addition, withdrawal is one of the most common Xanax side effects. It is experienced when someone reduces or stops using this prescription drug, which can lead to complications such as panic attacks, insomnia, and seizures. Withdrawing from Xanax under an inpatient drug rehab specializing in Xanax detox reduces the risk for complications and helps the individual experience a safer, more comfortable recovery. Xanax works by decreasing abnormal excitement in the brain. Xanax slows down the movement of brain chemicals that may have become unbalanced, resulting in a reduction in nervous tension and anxiety. Xanax works by boosting the effects of a natural chemical called gamma-aminobutyric acid, which is made in the brain. Many people who take Xanax recreationally or without a prescription describe the feeling as sedating or calming. Unlike some drugs, such as cocaine, that produce a high or euphoric feeling, Xanax users describe feeling more relaxed, quiet, and tired. These feelings may lead to falling asleep or passing out for a few hours. Mixing cocaine and Xanax is pretty common, which can lead to a coma, potential paralysis, or even overdose death. The effects of Xanax. Just because Xanax is legal and prescribed doesn't mean that it can't harm you. Unfortunately, there are a number of prescription drugs that many people abuse that is widely available. Even though pharmaceutical medications must be received via a prescription obtained from a doctor, they can still be easily abused. Xanax is one of the most easily prescribed medications, and due to its accessibility, it is dangerously prone to abuse. When used outside of the supervision of a prescribing medical professional, this anti-anxiety medication can do more harm than good. Although there have been a number of recent efforts aimed at curbing prescription drug abuse, this is still a major concern, especially for anti-anxiety medications like Xanax. While there remains a black market for addictive pharmaceuticals, it's important for everyone to know some of these substances' harmful effects on the body, especially the brain. Xanax and alcohol interaction. Using Xanax and alcohol together will intensify the effects of both substances. Researchers haven't been able to understand why this occurs. However, it's likely due to chemical interactions between Xanax and alcohol in our bodies. A study on animals released in 2018 suggested the presence of ethanol, which is the main ingredient in an alcoholic drink, might increase the maximum concentration of Xanax in the bloodstream. This can lead to an enhanced high, as well as enhanced side effects. It also pushes the liver to work harder and break down both Xanax and alcohol in the body. Mixing Xanax and alcohol side effects. Sedation. Both Xanax and alcohol produce sedative effects, meaning you'll experience impairment, drowsiness, or fatigue. The use of each drug individually may also cause sleepiness. Both drugs affect your muscles, making coordination, muscle control, and balance all the more challenging. You could end up stumbling or slurring your speech. These effects will worsen when the drugs are used together. Mood and behavioral effects. Xanax may lead to depression, irritability, and confusion. In some cases, an individual may experience suicidal thoughts, but that's not a common effect. If you experience suicidal thoughts, you should call for help immediately. Other rare side effects of mixing Xanax and alcohol include aggression, hostile behavior, rage. Alcohol can also potentially affect your mood in various ways. For some, it'll cause a boost in mood, despite it being a depressant. Others may experience adverse side effects, such as sadness. Alcohol also impairs your judgment and lowers inhibitions, making it easier to do things you might not regularly do. These behavioral effects and mood changes are more severe when using both Xanax and alcohol together. Memory impairments. Both drugs are associated with memory loss, and the effect is more pronounced when the two substances are used in conjunction with one another. Combining both substances increases the chances of a blackout, meaning you may not remember what happened. Physical side effects. In addition to the side effects listed above, these drugs can cause severe physical side effects. The most common physical effects of Xanax include low blood pressure, blurred vision, headaches, diarrhea, nausea, vomiting. Drinking alcohol in excess can also cause blurred vision, headaches, and other gastrointestinal issues as well. Again, using the two together will increase the chances you experience these physical side effects. The dangers of mixing alcohol and Xanax. Both Xanax and alcohol have individual sets of side effects that impact an individual's behavior and mental state. Because of this, the two should never be used together as it can cause life-threatening consequences. When used with alcohol, the introduction of Xanax to one's body can cause one's heart to stop beating, hamper neural activity, or slow your breathing to the point of respiratory failure, permanent brain injury, coma, or death. It also increases the likelihood of a Xanax overdose, which can lead to respiratory depression, seizures, and potentially even death. An abundance of Xanax and alcohol can relax and slow body functions to the point that the user's heart stops beating or they stop breathing, again resulting in a coma or death. Lethal dose of Xanax and alcohol. There is no known and confirmed lethal dose of Xanax for humans. The FDA found that the lethal dosage in rats is 331,171 milligrams per kilogram. Other experiments in animals concluded death in instances of 195 milligrams per kilogram, which is 975 times higher than the recommended maximum human dosage of 10 milligrams per day. If a person consumes a few drinks and has BAC levels between 0.05% and 0.15%, this will likely result in impairments such as slurred speech, memory loss, and poor driving skills. If someone reaches BAC levels closer to the 0.31% to 0.45% range, they may lose consciousness, overdose, and suffer from vital organ failures. The prescribed dose of Xanax ranges between 110 mg per day for anxiety and panic disorders. If you are taking Xanax without any side effects, adding alcohol will lead to undesirable side effects. This will also increase dependence and chances of taking lethal doses. However, the lethal dose depends on many factors like age, sex, weight, tolerance of the body, ability to metabolize Xanax and alcohol, other health issues, other medications you are taking. Someone with a Xanax addiction may take up to 20 or 30 pills per day. If the user decides to stop the Xanax dosages, they may experience withdrawal effects such as anxiety, restlessness, insomnia, and tremors. The development of tolerance and withdrawal are indications of addiction. If you or a loved one are struggling with long-term Xanax and alcohol addiction and a co-occurring mental health condition such as anxiety and depression, contact one of our helpful treatment specialists today. We Level Up NJ can provide information on dual diagnosis and detox programs that may fit your specific needs. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.